Antimicrobial resistance could kill more people than cancer by 2050. What's Europe going to do about this? How will Europe protect its citizens with this new health challenge? Alojz Peterle, what do you think that this legislature, this generation of European politicians will do to improve Europe's health?
I suppose it will follow the expectations of European citizens and will undertake more than in the past, because health is still an underestimated issue on the political agenda of the European Union.
Do you think that citizens really understand how deeply their lives will be affected by antimicrobial resistance?
I think they understand enough, and we know enough to do more.
Senator Mazzacani, the healthcare profession is very traditional in how it deals with antimicrobial resistance. Do you think that can change?
È possibile cambiare questa mentalità agendo sotto il profilo scientifico, effettuando delle ricerche mirate sugli ospedali e che possono dare appunto dei risultati che siano universalmente accettati.
Isabel Caselli, the scientific community needs evidence. What evidence is there that antimicrobial resistance, hygiene in hospitals can be improved?
The hygiene can be improved consistently because we have the possibility now to influence the microbial community on the surfaces of the hospital to help to fight against the antimicrobial resistance.
Is the evidence base strong enough to convince procurement practices to change, to convince established practices in hospitals to change?
It starts to be like that because, of course, it is needed a change in mentality of healthcare professionals, but we notice that now is changing this mentality, and this is a very good point to start with.
Do you think that there's an issue of awareness, or people moving towards a sense of fear, or do you think they're being paralyzed by fear of what to do next?
I think we can speak about the feeling of fear, and in the future I think that citizens will try to find hospitals with lower level of infections, and they are more and more informed which hospitals are those ones.
And do you think it's necessary to legislate to make that happen, or do you think this is a kind of market force approach, public awareness approach?
First of all, I think that single market should function in that particular area, because we have a solution, we can do more. We don't need to legislate, but to open the market for new solutions and for more effective methods.
And when you look at these more effective methods, is there a cost-benefit analysis where it's really worthwhile investing in a new process, or should we just put more money into doing the old stuff?
Of course, to invest more money is needed for the research, but I think that now we have enough results also for an analysis cost benefits, because our evidences are very clear and we can do something from tomorrow.
And do you think that policymakers will feel the pressure to move tomorrow, or are they going to wait for another generation when antimicrobial resistance will really be out of control?
I hope that now politicians are sensitized against toward this topic. Of course, there is the need for an urgent sensitization, general sensitization, because I don't know how much citizens are aware of this threat.
The European Commission's Anti-Microbial Resistance Action Plan, it puts a lot of emphasis on what the member states can do. Do you have confidence that they can deliver?
We have worked on both levels, as Union and as a member states. And there are cross-border issues which can be addressed only by the European Union. And the gaps we know have to be addressed by the Union.
Okay, the 7 universities in Italy have been studying this. What kind of outcomes in terms of research and actionable outcomes have you seen?
Abbiamo lavorato con 5 università e con 7 ospedali. Adesso il problema è eventualmente portare questi risultati a livello europeo e quindi a livello internazionale.
With Europe on the edge of another health crisis, 1.5 billion euros is lost every year. 25,000 Europeans die from health-related conditions affected by antimicrobial resistance. It's time for action.